Piper long. So aim of this study was to evaluate the impact of cessation of toothpaste in persons with migraine. And we usual OPD patients, headache, MRI normal, no other explanation of headaches, and at least 4 migraine episodes per month in the previous month. And that is a retrospective. We didn't do any screening phase. It's just they say that you have this much amount of headaches, and then we randomize the patients. Patients like cluster headache, attacks were excluded, secondary headaches were excluded. So it's a single center, randomized. Physician blinded means they send up, then they don't know what happens. And the team, which are non-doctors, will call these patients every week, and they have a diary to fill, and that's how we follow. So intervention is simple. You have no toothpaste is allowed, no tooth powder is allowed, no neem stick is allowed, no mouthwash is allowed. You just brush with normal saline. So you can buy normal saline from the medical store, just put a hole on it, just rinse and brush. No toothpaste. Control group, continue toothpaste, you don't tell anything to them. And physicians are given freedom to start either amitriptyline 10 milligram or metoprolol 25 milligram, both groups. So this is how this, and randomization was done by a computer-generated protocol. The people were trained to fill the diary, very simple diary, date, time of onset of headaches and intensity, so which gives a frequency of headache, and their headache intensity on a numerical scale of 0 and 10. But do you know that our patients won't fill any diary? You give somebody anything, no Indian patient is going to fill diary because he's least interested in your diary or things. He will not fill the diary. So they used to call them and get the headache frequency. So to do a study is almost impossible with our patients because nobody is going to sit and fill diaries and all. Then you have to call them. But it's a short 4-week study, so fairly okay, right? And change in, the primary outcome is just change in headache days per week or a period of 4 weeks. There's a primary outcome. Secondary outcome, change in headache intensity, headache freedom, and hospital visits. These were the secondary outcomes. Follow up technically every week for 4 weeks. Headache frequency, intensity, headache freedom, hospital visits, done by trained non-physician study explained. And the statistics, because it's only statistics, appropriate statistics with comparison between the study groups. A p-value less than 5%, intention to treat analysis, and all statistics conducted by IBM, SPSS, statistics, and things like that. A total of 106 people with migraine as per ICD-3 underwent randomization. Intervention group had 53, control group around 53. And out of 53, by 4 weeks, only 43 in the intervention group and 47 in the control group finished around overall response rate of 85%. Some people are not picking the phone and some people are not responding, and that's how it went off. So intervention group at the baseline, you had 53 almost. Say gender, 74% on the intervention group, control 79%. Baseline duration of headaches, almost median of 36 months. So they were, people had a long duration of headaches, some 15 to 138 in the intervention group and control. Baseline frequency was around 3 per week. 3 per week. So it's a pretty bad group in that way. It's a high frequency headaches. And then baseline intensity per week around 8 out of 10 with a range of 6.5 to 10 and 6 by 10. There is not gross difference between so properly randomized baseline. And the toothpaste people are using, there are many toothpaste people are using, but the most common toothpaste we have shown, others we have not shown, are toothpaste 1, 2, and 3. I'm not naming because of the other issues. Toothpaste 1 had sodium saccharin, sodium benzoate. Others herbal ingredients are shown. And then toothpaste 2 had limonene, sodium saccharin, sorbitol, sodium silicate, benzyl alcohol, and fluor, titanium silica, calcium carbonate, sodium lauryl sulfate, potassium nitrate. And toothpaste 2, toothpaste 3 had sorbitol, benzoate, and other fluoride and things like that. So what is the primary outcome? So week 1, there's a stopping in the week 1, the fairly 2 on this side, control 3, and by till week 2, week 3, not much difference. But week 4, the frequency came down to 1 with 0 to 2 per week in the intervention group, and it was 2.5 and 1 to 0.5 in the control group with a p-value of 0.001. And this is the way it came down, and baseline to week 1 to week 2. The green is the control and the yellow is the intervention group. You can see that how this is coming down in the intervention group. So the primary outcome was positive. The secondary outcomes, the intensity, you can see that baseline around 8 of 10, not much difference through week 3, but week 4, it just came down to 0 in the intervention group, and the range of around 0 to 6 and 7 persisting in the control group, and the p-value is again significant for the secondary outcome of the intensity. The proportion of patients who are complete freedom with headache, around 32.6% in the intervention group, around 14.9% in the control group, again be significant. Proportion of patients with 50% reduction in mean number of headaches, around 58% in the intervention group and 32.5% in the control group. And P is not below 0.05, but just around maybe a trend for significance, but not statistically significant. And proportion of patients with persons with migraine who visited the hospital for OPD or emergency visit came down in the intervention group to 3% and 11% in the control group, and significant difference in the both groups. One patient applied salt directly, had a gum bleeding, and had to stop and switch to 0.9% saline. And after switching to saline solution, no further complaints, no major dental complaints. And this, and in the next trial, we have included around 5 dentists, because that was another issue that the ethics committee created, that you don't have a dentist on the board. So next trial, we are doing the dentist is there in the board. Around 5 dentists are there to check them, and they will WhatsApp a picture of the teeth. But many of us have stopped toothpaste for 3.5 years, just brush with water and saline, no dental caries or anything. Unless you take junk food, it should not go, right? So both organic and inorganic compounds have been associated with headaches in animal and human studies. The big, large references. And many of these substances absorb through the buccal mucosa because of its good vascularity, permeability, and less enzymatic activity. And they bypass the first pass metabolism in the liver. And there's another interesting way of spreading of substances from, or conventional is that you eat something, it just goes to the gut and then goes to the liver and goes. That's one way of systemic circulation. Second is that you just get a buccally, goes to the jugular system, jugular veins, goes to the heart, pumps to the heart, bypassing the liver. There's another way of spreading is through the trigeminal nerves. So through the trigeminal nerves, chemicals spread intraaxonally or perineurally. And this pathway is well explored in the nose. In the nose, when you give inhalation of medicines or even monoclonal antibodies, it just goes through the trigeminal route to the trigeminal ganglia and then goes to the brainstem and goes up and down. And this is well explored for the inhalation. Same thing may be happening with the mouth also. So we have to find the animal models and do this transneural transport. And then one of the reasons why trigeminal neuralgias are in the V3 distribution. It may be a transneural spread of the chemicals going to the trigeminal ganglia and changing the circuits in the brainstem. Okay, so this may be another route of possibility. The importance of that route is that it bypasses the blood-brain barrier. This route bypasses the blood-brain barrier. So the latest one of the antibodies against CD40, some frexalimumab, is given intranasally for multiple sclerosis. Studies have already, phase 3 is done. That goes through this route and bypasses the blood-brain barrier. So it's an interesting route. And that is studied in the nose, but the buccal mucosa and the trigeminals are same. So we presume the same mechanisms may be happening with the chemicals. So there is, in most of the toothpaste, there is something called carrageenan in the gum. To make a toothpaste is so not that easy, because we were trying to replace and make a toothpaste with the least ingredients. It was not possible because you need something to hold the chemicals together. So you need these gums called carrageenan and xanthan gum. And what this does is that it makes a film over the buccal mucosa, right? And then some of them can increases the epithelial permeability, and like xanthan gum and sodium lauryl sulfate. So one of them makes a biofilm, and on which these chemicals sit. And some of these chemicals do the break of the epithelial permeability. And then triclosan is also banned in in the Europe and all, because it causes cancer. Triclosan, it is there in our toothpaste, right? And then blood-brain barrier disruption by titanium and silica. So titanium and silica is added to the toothpaste because they give a friction, and they are the nanoparticles. And titanium nanoparticles are very toxic. It is one of the most toxic nanoparticle. And this titanium nanoparticles, it disrupt the blood-brain barrier. Sorry. titanium nanoparticles, they destroy the blood-brain barrier, titanium and silica. And after this, all these things, all these chemicals, when you take a drug-induced headache, for example, silastazol or one of those drugs, they act through one of these 5 mechanisms, either TRP channel stimulation, and the TRP channels are clustered in the trigeminal ganglion. So when the TRP channels are stimulated, there is a release of calcitonin gene-related peptide. Then nitric oxide production, and then cyclic AMP, cyclic GMP, and neuronal hyperexcitability, and some dysfunction of gut-brain axis, and then causes release of chemicals. And this is the way this happens. And so this is a summary of a big, deep research of months and years, okay, how each one acts. So you take potassium nitrate, silica, arginine, and titanium dioxide, fluoride, they release as nitric oxide. They are nitric oxide donors. Arginine, potassium nitrate, and sodium fluoride again increases cyclic GMP. Sodium lauryl sulfate, sodium methyl hydroxybenzoate, benthol, camphor, limonene, piper, Synchor, they're all TRP receptor channels. So genetic studies have shown that TRP-M8 is more in migraineurs, and menthol is a TRP-M8 stimulant, and they have now produced blockers against TRP-M8 as the next treatment for migraine, which will all be coming up. So all these acts with the TRP channels, TRP melastatin, TRP vanilloid, TRP ankyrin. Then we have sodium fluoride through cyclic AMP. So fluoride is one important thing which has multiple mechanisms of actions like nitric oxide, cyclic GMP, and cyclic AMP. And all these things finally results in activation of trigeminal ganglia and trigeminal nucleolus caudalis, and releases CGRP, which is a key ingredient which causes trigeminal stimulation of the afferents and nociception and vasodilatation. So in conclusion, cessation of toothpaste use significantly reduced headache frequency and severity in people with migraine. This appears to be a cost-effective strategy for migraine management. Further clinical and animal studies are needed given their favorable impact on migraine burden and their public health importance. After participating, okay, this leave it, okay. So now, very interestingly, this has been courted by Medscape after the presentation, and most likely their journalists who are sitting there in the meeting, and then it has gone all over the world now, and it's good. Thank you for the entire team and all our consultants, Dr. Raghu, all of them have participated in our study. And then there is a big team of people, Dr. Mr. Shagun, and then Asta, so many people are there. They have all done the statistics and collecting data and doing the study, and which is a zero funded study. Nobody got any single paisa for doing the study. All of them have done very selfless work to get it done, and I thank the entire team who have done this, and thank you, all of you. Thank you.
Can we ask some questions here?
Yeah, free.
Yeah, very interesting observations and all that. So, have you stopped using toothpaste now?
3.5 years.
All the team, the whole team?
No. some get scared, and little bit they may use, but many of the people who are migraine, and then I'm not showing the cases because it will take 24 hours to see. This all started with cases where we started initially with the herbal toothpaste. I have big graphs and data and re-challenges of, we started with the herbal, the Dabur Red and the Vico and the Himalaya. We thought the camphor was the main thing. Then reviewers started asking, why are you blaming only the camphor? Then we started searching other ingredients. Then we knew that every ingredient causes one or the other problems, and there's a mechanism for that. Then we started with the ordinary ones, right? And now we are working the same thing. We have done studies on anxiety, psychiatric disorders, hemipain, trigeminal autonomic cephalalgias, trigeminal neuralgias. So we have great improvement in patients with trigeminal neuralgias. Not always 100%. So then we realized that it's not just the toothpaste, all right? It is the chemicals only from the soap to the toothpaste to the balms. The toothpaste initiates the headache in a way, and the balms perpetuate it. Balms causes relief. If you put Vicks and Amartha, then people get relief. Around 50% say they relief. But we have seen the frequency have increased in these patients. So another paper we published was the over-the-counter balm usage in people with migraine. So we analyzed that people are getting better acutely, like NSAIDs. But they cause a medication overuse type of headache, and the frequency goes up. So what we presume is that the kindling is happening. You don't say kindling in the pain system, we say sensitization, central sensitization. So what is happening is that there is a layering of chemicals which doesn't cause anything acutely. Toothpaste is not killing you. But this small stimulus which is adding over time causes kindling of the brain and changing the circuits. And once it starts, it goes slowly, weekly once, monthly once, then weekly many times, then causes daily. So that is how it evolves over the time. The migraine evolves over time. So the kindling, the best time for kindling is 24 to 48 hours. Any stimulus which is given 24 to 48 hours is the best for the kindling. And the manifestation depends on which neurons are kindling. If it is in the pain neurons, you get migraine. If it have the hypothalamus and the pain neurons combined, you get the cluster. If it's in the trigeminal nerve, and you get the neuralgias and the trigeminal system. And if it is in the amygdala, you get anxiety. If you're in the more orbitofrontal, you get psychosis. And so it just looks that we are changing our brains by repeated exposure. And the chemical kindling appears the main reason. So the cases, we built this RCD because we are convinced with the cases and their follow-up. Indian cases are there. One girl came to me and told, this is the last neurologist I am seeing. I'll do suicide if you don't clear me. So she had 6 years migraine, went to many people, tried many things. Then I said, what is your toothpaste? And Colgate. And you just stop the toothpaste and come and make me. So she didn't come back. After 3 months, the mother told her, doctor, do you treat menstrual pain also? Then I told, don't talk to me. Please send me the diary. Then they sent the diary of the previous headache. So it is a beautiful diary, and show that in this. The headache goes over 1 week after stopping the Colgate, okay? Then after 1 month, she rechallenges the same toothpaste, and that day severe headache she gets. Then she stops. So it's not easy because you are trained to paste, it's like a tobacco addiction. It's not easy. But if you're convinced, then you have to do it. And indeed, renal failure, liver failure, and cancers may be this, okay? Over time, changing the genes and the receptors. Thank you.
Other consultants may not be having migraine headaches, that's why they are not stopping.
I'm personally a migrainer. I suffered 50 years with Colgate. Now I'm good.
Before the quiz, I think Dr. Kiran has got a small announcement.
Sorry to